Assalam-o-alaikum. My name is Babar and I welcome you to my YouTube channel. Today we will be discussing about diabetes mellitus. In this lecture only introduction and epidemiology and etiology will be covered. Let's get started. Diabetes mellitus is a group of chronic metabolic disorders characterized by hyperglycemia that may result in long-term microvascular, macrovascular and neuropathic complications. Microvascular complications are the long-term complications that affect small blood vessels, and these include retinopathy, nephropathy, and neuropathic complications depend upon the nerves affected. This cause numbness in legs, feet, and hands. These complications arising due to diabetes are the leading cause of new cases of blindness among adults and stage renal disease, non-traumatic lower limb amputation. Limb amputation means if a person get injured, his wound will not be healed and this will result in amputation of the organ. Amputation means to cut off. New cases of blindness occur due to retinopathy, that is the microvascular complication of diabetes. Okay, next is the epidemiology of the diabetes. Worldwide prevalence of diabetes mellitus has been risen dramatically over the past 2 decades, an estimation about 30 million cases in 1995 and 177 million in 2000. Based on the current trends, more than 360 million people will be diabetic by the year 2030. The prevalence of diabetes type 2 is rising much more rapidly, and Pakistan is among the top 10 countries of Asia that have more people with diabetics. Now move towards the etiology, the causes of diabetes mellitus. Increasing prevalence of diabetes mellitus is partly due to life influences, lifestyle, ethnicity and age. Type 1 diabetes mellitus is diagnosed before age 30 but can develop at any age. Type 1 diabetes mellitus is an autoimmune disease in which insulin producing cells in the pancreas are destroyed. The presence of human leukocyte antigens are associated with development of type 1 diabetes mellitus. In addition, individuals often develop islet cell antibodies, insulin and autoantibodies. It is believed that when a patient comes for diagnosis of type 1 diabetes, most of the patients have 80 to 90% of loss of the pancreatic cell function. The remaining cell function at diagnosis creates a honeymoon period during which blood glucose levels are easier to control and smaller amounts of insulin are required. After this, remaining cell function is lost and the patient becomes completely insulin deficient and requires more exogenous insulin. During honeymoon period, a person with diabetes seems to be better and needs only minimum amount of insulin. Following graph will explain the honeymoon period in a person with diabetes type 1. You can see when the cells are in good condition, then there is normal insulin release. With the passage of time, the cells die. That creates a lower amount of the insulin release. Latent autoimmune diabetes in adults. It has slow onset and related to type 1 or type 1.5. Is a form of autoimmune type 1 diabetes that occurs in individuals older than the usual age of type 1 diabetes mellitus onset. Patients are often mistakenly thought to have type 2 diabetes mellitus because they initially respond to treatment with oral blood glucose lowering agents. These patients do not have insulin resistance, but antibodies are present that can destroy pancreatic beta cells. C-peptide is abbreviation for connecting peptide. C-peptide is made when proinsulin splits into the insulin and C-peptide. They split before proinsulin is released from endocytic vesicle within the pancreas, and there is one peptide for each insulin molecule. Routine measurement of C-peptide levels, insulin level, and proinsulin are not recommended in most patients. However, C-peptide measurements can be used to distinguish between type 1 and type 2 diabetes mellitus. Values are given. People with type 1 diabetes have C-peptide level below 1 nanogram per ml, and those with type 2 diabetes will have C-peptide value greater than 1 nanogram. Here are two definitions: IFG and IGT. IFG is defined as having a fasting blood glucose level between 100 and 125 mg. IGT is the postprandial blood glucose. It is defined as having a postprandial blood glucose level between 140 to 199 mg per deciliter. The development of IFG and IGT or A1C between 5.7 and 6.4 places the individual at high risk of eventually developing diabetes. A1C is glycated hemoglobin, that is the derivative of hemoglobin. Type 2 diabetes is slowly progressive in its development. Following are the risk factors of type 2 diabetes mellitus. First degree family history of diabetes mellitus, that may be parents or siblings. Second is overweight or obese. Third is habitual physical inactivity. Race or ethnicity, Native American, Latino or Hispanic American. Previously identified IFG, IGT or A1C between 5.7 to 6.4, and hypertension. That's all for today. Next lecture will be on the pathophysiology of diabetes. Kindly like the video and subscribe the channel for more updates.